Welcome. Today we have Samantha Richard with us to talk about working as a patient care assistant, I believe, right?
Mhm.
PCA?
Yep.
Oh,
Hospital nursing assistant. Yeah.
so what does a PCA do?
So day to day, you start off usually 7 a.m. or 3 p.m. You get report from all the other CNA PCAs that were on the floor. You get a rundown. I work on the neuro ICU, so we only have about 18 beds. And you'll get a rundown of all the patients, like their level of care, whether or not they are full code, DNR, DNI, that kind of stuff. And then you learn what responsibilities weren't done, like on the last shift, like certain baths, cares, transfers, stocking the floor, like basic day-to-day roles as a PCA. You get to discharge patients, take them to their new rooms, get them off the ICU, or you get to land post-ops and get them acclimated to the floor and like help the doctors and the nurses. You're all one big care team there. You get to work side by side with some of the most amazing doctors that I've ever met, and you get to help with assessing and the nursing process, like right there. So you learn a lot. You learn a lot very quickly. Um, the day to day goes by very fast. You're doing like all the acts of daily living for your patients. You're bathing them, you're helping them get to the toilet or any of those kind of needs. You get to kind of build rapport with them, which you really need, like for the nursing staff and for the doctors and for all kind of diagnosis. You need to have like that trusted relationship with the patient. So you need to be able to like get their respect and know that you respect them for them to open up to you and like kind of explain if they're in pain or if they're withholding anything from the nurses for any type of like anxiety reason. You get to know a lot of people. You get to meet a lot of people and a lot of stories you learn. And you get to do it all on a great big team of people that care like the same amount. You get to experience all these people's lives. Sometimes you have to be very, very cautious because they're going through a lot. Like they're in the hospital, and that's always so scary. And you can kind of put their mind at ease. You can kind of love on them. Like one of the things that I was taught on my first day was just kind of pamper them like they're in a salon. Like, so if there's a patient who's came from a nursing home and hasn't been like shaved up or anything in a while, or just like they're used to being clean shaven and it's all grown out, as long as they're not on like blood thinners or anything that would stop me from doing that, I will shave them up, give them a haircut, do that kind of stuff, give them like, we do these like shampoo caps and like deep conditions for some of our patients, and you just get to make them feel safe and like a person instead of a patient.
Very cool.
Yeah.
Sounds like you really enjoy it.
Oh, I love it. I
How
love it.
long have you been in this role?
I've been on the neuro ICU for 2.5 years, and before that, I was a CNA in a memory care unit here in town.
Okay.
Yeah.
So what was it that made you want to jump from a CNA to this role?
CNA was wonderful. I loved it a lot. I was working in memory care, and the only issue with that was I got my CNA license right when I was about to turn 16. And I jumped into that role very quickly. But what I learned was it's really only like 2 to 3 CNAs for a lot of patients, and you don't get that individual time with them as much as you'd like. Like doing the acts of daily living, bathing them, getting them to the bathroom, taking them out to dinner, and like feeding them and everything like that. It felt, it got done. But I know that as a PCA or a CNA, maybe in a better staffed area, I could have given like more. But I do miss being a CNA. That was really fun. That was really fun. Just a big like resident hall full of a bunch of people just doing bingo. It was really sweet. Yeah.
So was there additional education you had to do from the CNA to the PCA role? And what
Yeah.
was that like?
So CNA was 1 semester. You do like all the test outs. You have like the big state test at the end, which is not as scary as it seems. You like learn how to do all the acts of daily living in that class, but then you do one more class. I did mine at RCTC, senior year of high school. Actually, I did PSEO, and then I got my CNA or my PCA right before I was about to turn 18, and then I could start at the hospital. It's just one more class, and you do clinicals at the hospital, and you do your CNA role while learning how to transfer patients, take those vital signs like in the hospital, learning all of the systems with charting and like medication wise, you get to do a little bit more as a PCA than you did as a CNA because there aren't many nurses in the nursing home, but you're working on a team as a PCA. There's a whole line of practice right there with you. So just
And do
one
you
semester.
and do you see yourself staying in this role for a while, or is there advancement that you could do beyond this degree?
I'm currently in nursing school.
Oh,
I am in my first semester nursing school. And while doing that as a PCA, it is amazing because you get to watch what you're about to do in a couple of years. And you're just like very anxious to go do that. I think it's an amazing learning opportunity. I will be a PCA for the next 2 years while I'm in nursing school. And I probably wouldn't have it any other way. I know it's what I'm gonna do the rest of my life, and I'm already kind of in that role while getting to experience more and more. And through RCTC and through the big hospitals here in town, they help you further your education. Once you, usually at a nursing home or wherever you're going to work, after a year or so, they'll do tuition reimbursement after you've been committed to them. So they can help you get further in school. I know a lot of nurses that are going on to be nurse practitioner or nurse anesthetist, and where they're working is helping pay for that, if not all of it.
very cool.
Yeah.
And you mentioned starting at like 16, you knew that
Mhm.
you wanted to do that. So at what age did you decide healthcare was the way you wanted to go and that CNA was a path you wanted to start on?
So I moved here from Florida when I was about 15, and I had never even thought of it. It was not anything introduced to me. And then I moved to Med City, which is a real thing. It is it is very medical oriented here. I'd never even like thought of nursing before I moved here. My high school had like a 36% graduation rate, and moving here and seeing all the opportunities like PSEO for students and just like kind of diving right in to be a CNA, what kind of caught my interest was sophomore year, I did a medical terminology class at RCTC or the CTEC.
Mhm.
And it just opened up a world. It really did. And it just showed like caring for people in more of a holistic way, like learning all of these different things that could help people and seeing the passion from the instructors who have been nurses for so long, just teaching this stuff, being like, and telling all these crazy stories, being like, oh my gosh, I had this patient code and all these different things, and everyone was running in and out of the room. And you're like, yeah, that sounds amazing. I want to do that. So I had no inclination. I actually planned on doing either journalism or psychology, like a psychiatry path. And then I came to Rochester. My world changed a little bit.
Yeah,
It's a beautiful place here.
yeah, that's very interesting.
Hmm.
The psychology and psychiatry path would at least be similar, but the journalism would not be.
Not be even close, yeah.
So
So
what benefits do you think there are in the role that you play and in the healthcare field?
the healthcare field, it sounds odd. Maybe it's just because of like the unit I work on, we're all very close, but it's a new family. It is a home away from home in a way, and you're all kind of working together to make sure that these patients feel safe and respected, and you're getting to know all of these people. I think one thing that is always underestimated is when someone trusts you, you will learn like so much about them, and you'll learn how to take care of someone without medicine, just being there, listening, being kind. I think that in a room full of really smart people, which you're probably in right now, the best way to distinguish yourself is by being kind because people remember how you make them feel. People always remember how you make them feel. So, yeah, that's my answer on that one.
Yeah,
Benefits, you get to know people, you get to understand yourself more. You would kind of put yourself in their shoes, which is all that empathy is, and trying to see how you would react in this situation. Like, say a patient comes in, and due to COVID, we can't have visitors right now. So, someone just went through brain surgery and they're in this hospital room and they're alone. And you can go in and try to make it as comfortable as possible. You can turn on music, watch a movie with them, do that kind of stuff. But just remembering that if you were in their shoes, you'd probably want someone talking to you, and just extending an arm or just even talking to them for a few minutes can change their outlook because it's scary. It's scary and it's a lot, but it's very easy to make someone just feel a little bit more comfortable. So,
Yeah, and you mentioned empathy, and I'm glad you brought that up because what other soft skills, like that welcoming feeling,
mhm.
what other skills like that should a person have to be able to do this job? Because yeah, it's not for everybody, you know?
Yeah. I think social skills, understanding how to talk to really anyone, is something that builds as you do the job. You get more comfortable with different aspects of conversation with people. You meet a lot of characters. So just being able to keep like a straight face when they say maybe something a little different, and you get to realize that a lot of people are the same. They just want someone to care, to ask the questions. I think one of the easiest things to do is just ask them about their family and like what they do at home, hobbies, things like that, and what keeps them sane. Um, because you can introduce that. You can introduce that into your work life with them. Another soft skill, I think it's being like going with the flow. It is just adapting very quickly. That comes with practice as well, because you'll be with a patient, and if they start to have trouble breathing or their heart rate goes in astronomical levels, and you're able to get the nurses and the doctors in there as quick as possible, assess, diagnose, and implement like right away. As a PCA, you don't have the scope of practice to do those later steps, but assessing is quite easy when you're able to tell that they're having trouble breathing and everything like that. Um, Soft skills. Let's see. Conversation, empathy, putting yourself in their shoes does everything. I think sympathy is great, but some of these people don't want to be like pitied in a way. They just want to understand that they're going to get through this and you're going to be there with them. And it's not like a shameful thing in any way that they were there at all. Things happen. If you were in their shoes, you'd want someone to do the same for you. So, yeah.
Very cool.
Yeah.
What could you tell us a starting pay rate for somebody in that role?
Mhm. As a PCA, I started at, I want to say like 1750. And then
Okay.
the 2.5 years, I'm up to about 21. They give a lot of raises within the first few years. And then as a CNA, I was starting at 1350 and made it up to 15 within the 2 years. So it's
Um,
pretty good pay for 16 to 18. I'm 21 now. Yeah,
yeah.
pretty
And
good.
then looking at the nursing is going to even give you some more opportunity for some
Oh,
income.
yeah. It's a good push. It's a good push.
Yeah.
Yeah.
So as we are coming to have high school students watch this, and
Mhm.
just like you did, you took a class in high school that sparked your interest. What
Mhm.
classes should these students take to get them interested in healthcare, or what would you recommend would be a benefit for them?
I did medical terminology as soon as I could, because getting an understanding, honestly, watching that and like doing that class and watching Grey's Anatomy at the same time is how I know a lot of people did it. Like they were like, I got very passionate about medical shows. And as I took like Latin and medical terminology, you get to understand what they're saying and you realize that it's not that hard and you could be doing this and that would be amazing. Um, and then I took sociology and psychology as well at CTech, and it just introduced a world of like understanding people more, and that was a huge step. Um, Other than that, biology, microbiology, anatomy in high school was super fun. It's hard, but it's really fun. It's worth it. It kind of introduces you to like a more intense style of learning and you're able to handle it, and that's important. That's great.
All right. And any final advice for just anyone watching this and not sure about their career path? They don't know if healthcare or another ones they want to go down, but any advice for those folks?
Life isn't a race. So it's okay to try some stuff out. I tried out a few things. I tried out multiple nursing homes until I found the right fit. I got to know a lot of people and heard their stories who are nurses or PCAs or CNAs. And I think just expanding your knowledge on people can explain what you want to do in a way. It's going to help you get there, and no matter what you choose, as long as there's like a passion or a drive, it's going to be worth it and it's going to be great. So, just go with your gut.
All right. Well, thank you for your time today, Samantha.
Yeah, thank you so much. Good luck, everyone.